It looks like that's about it. So we got a quorum, as they say in board meetings. We've got a good group together. Thank you for taking time out from your busy day. Again, good morning, good afternoon if you're coming in from the East Coast. My name's Steve Willey. I'm founder, CEO of Innovega, and I have with me a couple of colleagues. Isaac Jean-Paul. Isaac's an accomplished Olympic athlete. He's a writer, and he happens to be legally blind. And he's joined our team and offering us wonderful insight into a very large community that he's a part of and represents so well. Also, Michelle Russell from our marketing team. Michelle is handling the logistics of this call. So if things go wrong, it's Michelle and not me. As a format for today, I will present a good amount of material. We've had some really super events in the last 6 months, and I'd like to lay that out for you. There's also going to be a Q&A section at the end after the presentation, and you should have a chat button in your menu, probably at the bottom of your page. So if questions come to mind, if you want to hit that button, type in your question, and at the end of the presentation, we'll look through that and we'll answer as many questions as we can. I will share my presentation right now. Bear with me, I'm getting there. And you should see a full screen. Do shout out to me if you don't. So Innovega, all of you will know that we are in the business of smart glasses. In part, we started this company recognizing that smart glasses would be very difficult. Smartphones had taken hold. We all have one. Smart watches, many of us are using smart watches today. And so smart glasses seemed inevitable. Your head, your face, that's where the action is. Your perception, your vision, 80% of your perception, your hearing, speech, of course, and you're not far away from cognition and memory. So smart glasses would happen, but fitting glasses to the many different faces and different visual systems would be extremely difficult. And on that basis, as engineers, we wanted to rise to that occasion and deliver that solution. This webinar is being held today because we're coming to the end of an investment opportunity. It is for accredited investors, and there will be opportunities for those of you who are not accredited, and we can get you the information if you're unsure as to what accredited means. But we're going to close this up in a week or so. So those of you who have started a process of investment, please complete it. I'd hate for you to miss the opportunity because there's some sizable discounts available as we close this up. So we've got the smart glasses paradigm. Where are we going to take it? Where are we going to launch? Companies like Microsoft, they have the HoloLens, and they took that to enterprise, to warehouses, and of course to defense. Others, Meta, that's an entertainment product. The Meta VR solution, Oculus, is an entertainment. We wanted to do something where we could proceed immediately into an environment or a community that didn't need connectivity to 5G or didn't need new content. For example, patients who were visually impaired, legally blind, they just needed to see. Hearing impaired, they just needed to hear. So we selected as a launch opportunity the patient community, and vision impaired was natural, and that we're essentially vision experts. And so we proceeded on that basis. So the problem, and every company has to have a problem and bringing a solution to bear against that problem. The problem for individuals who are visually impaired, legally blind, is they've lost the connection to their world. They've lost their vision, their sight. So simplistically, that's what they want back. We knew this market had some size and breadth to it. And of course, we want to have maximum impact. But as we dug into it, we found out it's enormous. 285 million, in fact, approaching 3 million today. individuals are visually impaired, legally blind, and it's expanding. You live long enough and your eyes get worse, your hearing gets worse. So we are living longer, and therefore the market is increasing on an ongoing basis. Vision is responsible for 85% of your perception, of your world, of your experiences. So even modest impact to your vision has substantial impact on your quality of life and independence. Just think about ability to read, ability to recognize a loved one if that was taken away from you. And the assistive aids, the help that's offered to this enormous market are limited. Either they're really quite exotic. I mean, using a guide dog is something that very few are able to achieve at a cost of $20,000. No wonder why. And then, magnifying glasses, white canes. For us, it all seemed very limiting. And in fact, that is the case because only 1 in 1,000 visually impaired use any form of aid at all. So the opportunity is to meet the needs of this large population and simply deal with the problem that they cannot see, recognize, read, all the things that those with normal vision take for granted. In the US alone, and it's natural for us to think about launching into the US, there's about 6.5 million patients who are perfectly suited for the type of product, the smart glasses and our smart glasses that we're bringing to market, and it's a growing market. So others are seeking to offer value or benefit to this community. And showing you above the top two, on the left-hand side is a headset, and there's a lot of these products available. So essentially, it's a VR headset with cameras on the front, and you expand or magnify whatever the cameras are looking at, and that enables a person who's visually impaired to recognize and see better. On the other hand, it is a headset. It's a VR-ish headset, and one's not going to be comfortable in a restaurant reading a menu wearing a VR headset, or even watching TV with family, certainly not walking down the street. On the right-hand side, what's considered an advancement are goggles, and again, they're goofy, they're uncomfortable, and they're obviously not selling well into this large community. So what's needed is a pair of glasses, the same sort of glasses that 80% of us own, except display glasses, digital glasses that somehow have a camera and somehow take the real world and process it so that those wearing it, the visually impaired wearing it, will reconnect with their world. So our solution is that simple: enable visually impaired to see their world, to read, recognize faces, navigation, all the things that, again, normally sighted take for granted. We achieve that by offering a combination of an optical prescription. Again, those with normal vision get glasses, they get contact lenses, but add to that a digital prescription. So given that our glasses have a display element to it, and increasingly, an AI element, a connected element, a cloud element, but with a display element, we can really work magic. We take the combination of the display and the optical prescription, and that's where wonderful things happen. These glasses need to be personalized. There's many, many different diseases that make up the 285 million folks with vision impairment, so they have to be personalized. And we've developed 2 pairs of glasses that we will take to market. And one of them, I'm sure you've heard before, it's a combination of smart glasses, just like normal glasses, and wearing a soft, modern, disposable contact lens. This solution is so powerful that it is valid for all patients, even those who are severely legally blind. A subset of that is a pair of standalone glasses without the contact lenses, and it will work for certain patients. And the testing we've been done has convinced us that it will work for many patients. And the immediacy of putting on a pair of glasses and the patient seeing their world, reading, recognize their colleagues, learning, as we all do, but learning at an accelerated rate, that's all possible. And so both of these solutions offer vision, but they offer quality of life that has been lost and personal independence. So here's just some evidence of why we're so excited. This is the combination of glasses and contact lenses and independent testing by Ohio State University. This is where you go, kind of, the gold standard, if you will, to have them test and then publish their data. And the column on the middle to left-hand side is their vision of these individuals who were tested, their vision for looking into the distance or reading. And the 2115 means that their vision was 6 times worse than a person with normal vision. They would have to stand 6 times closer to someone or something in order to be able to interpret it. And immediately after the test, with our glasses and lenses in this case, these individuals were tested again. You can see on the right-hand side that miraculously they were functioning, looking into the distance at a 20/20 level, and near reading, looking at a smartphone, tablet, the 20/20 level again, 20/21. And they were able to read at a normal distance, and that's a big thing. Again, on that combination, smart glasses and lenses, the contact lenses need an FDA approval, and we have been proceeding through the trials over the past multiple years. They're complex, they're costly, and we've made good progress, and we are in the final test phases of the contact lens in order to gain an approval and then be able to sell the lenses and glasses combination. So what's our market strategy? We've identified patients and visually impaired as our launch strategy. And we've talked about here 2 different models, combination of glasses and contact lenses that are the holy grail. It not only does it deliver superlative performance in normal format glasses for the vision impaired, but it also has applications well beyond, you can imagine, into gaming and defense and public safety, etc. We're going to finalize that development. We'll continue to work, and particularly the contact lens component, to get a contact lens manufacturing partner and ultimately an FDA and other regulatory approvals that we would need if we took product into other countries. But, and I think this is most exciting, we're going to accelerate to market right away the standalone glasses solution, because we have evidence that it provides amazing results, notwithstanding the fact it doesn't have the greater benefit of using a contact lens. And as I pointed out here, we avoid the immediate expense and the time taken to gain an FDA approval. These glasses, the standalone glasses, because they do not use a contact lens, do not need an FDA approval. So that's off the table. We don't need a contact lens partner, and that, the complex, the opportunity or the need to bring on a partner is, it takes time. It takes money, and it's complex. That's gone. And we have the flexibility to launch, once we have commercialized the elements of these glasses, but to launch in any country we wish. So United States is the obvious, but if we wish to launch in Turkey, we could. These are the testimonials. This is not the university proof that I was showing earlier for the combination glasses and contact lenses. These are individuals in the past several months that have come by our clinic in San Diego, and they have to be 5 individuals essentially with different diseases, and they're either severely visually impaired or they're legally blind. And I should be able to play this for you. You may have seen some of this in the emails, but I will play them now one by one. Hopefully you can hear it.
My name is Isaac John Paul. I'm a Paralympic track and field athlete.
Coming into this, if he can clear it from his previous world record. Oh, he's done it!
My visual impairment is juvenile retinoschisis. When I was first told about Innovega's eyewear system, I was immediately blown away.
Oh, we got it! Yo!
I never thought that there would be a contact lens that would pair with a frame of glasses that have a camera in front of them, and it would help you see.
When we put the device on him and changed the magnification, he was able to read all the way down to this line right here.
When I had the opportunity to come into the office and try these tools out, I immediately thought of endless possibility.
Hopefully you were able to hear that. Let's play another.
When I was a little girl, I didn't think that there was going to be anything that could help me see. I'm the first person to tell somebody that I want to be independent, and the fact that I was here today and I was able to read the really, really small print, D, C. And then I normally have to see somebody about 3 to 5 inches from my face in order to actually see the details of their face. And being able to put on the glasses and look at people in their faces and be like, oh, hi, that's what you look like. That alone is mind-blowing to me.
And the next one is Megan. She traveled over 1,000 miles. She brought her husband. She brought her new baby just to test our glasses. Here she is.
The way I see the world compared to people with 20/20 vision, it's a lot different. And to be able to change that so I can see what other people see, there's nothing better than that. When I put them on, we viewed a few videos, and when we were viewing those videos, I felt like I was in
I'm sorry.
a movie theater. I felt like the TV was right here. I was just looking around the room. I could see so much. I could see all of the people in the room. I could see everybody's faces, and I can't normally do that. When I was looking at my husband wearing these, I saw every detail of his face. It's gonna open up so many things, and being able to talk to somebody, have a conversation, and make eye contact, and read their facial cues, which I can't do right now. So I'm just guessing. I'll be able to read books. I'll be able to go to events and actually see what's happening. It's a special thing. I never thought this was something that would ever happen. Never thought there would ever be something out there that could help me see so well.
We're doing okay for time, so let me play a couple of others. Just 2 more.
So my name is Patty Gio. I have pretty severe macular degeneration at this point, and I want to find something that will allow me to live a life still that other people my age can live. I don't recognize people when I see them anymore in stores, or I could walk right by my next door neighbor and not even know it was them. They turned on this screen inside of them that completely was able to be adjusted to be the size I needed it to be able to see things the way other people see them. I could read a lot better with them on, and when they did the eye chart test, I did really so much better on the eye chart test, I can't even explain it. The thing the glasses really did for me was being able to look at a screen, being able to look across the room, to be able to see people's faces, to be able to see the whole room. It was just like seeing things in a whole new world for me again. If these go to market, I will be the first one in line to buy the first pair. I mean, I will definitely want that pair of glasses.
And here's a final brief video.
My name is Paul Simmons. I was diagnosed in 2021. And since then, I've been really searching for a way to see better. I get a lot of distortion. 6 months ago, I quit driving. When I go to baseball games, I have trouble seeing the whole game. Just watching TV. The scroll bar at the bottom that will give you news and all that, I can't read that because of waves. It goes up and down. I don't know how they did it. With what I just took, the demo, I could drive. It's like watching high definition TV for the first time. Somebody would go through what I went through, would go for this without any question. But I could see like I haven't seen in a long time. I mean, I'm excited about it. It's a winner. I could sell this thing. I tell you, easy.
I apologize if that was a little choppy. I think we just learned that if I move my cursor around on the screen, it's going to freeze things up. But those are 5 remarkable individuals, and we had absolutely uniform results in that immediately upon wearing our glasses, our standalone glasses, no contact lenses, they were able to see things, experience situations that they hadn't done for decades or ever. On that basis, we have a winner, and we're going to take that to market as soon as possible. Here's the business team, leadership team that will take it to market. I have experience starting companies like Innovega and developing them, building them, and listing them on large exchanges, stock exchanges, or selling them. The whole business creation aspect is fascinating for me. Jay at the center is a systems engineer, brilliant individual, and he's able to work across the many components of our solutions, everything from mechanical to electronics to optics, and the contact lenses, of course, and materials and processing. So we're very fortunate. And Arthur Zhang joined us last year. Arthur came to us from Apple. You've probably seen the Apple Vision Pro. It's not the Apple glasses that they promised, but Arthur led that team. And what he concluded from that work was that the problem is that difficult. And as he thought through Apple versus Meta versus Microsoft and Google, there was really nothing on the roadmap that was going to deliver the type of glasses that people would want to wear. So he joined us. We've got a large advisory board. Our advisory boards, business, clinical, technical, to enable us to be on a path that will bring us success as quickly as possible. So in summary, we are literally able to and going to transform the lives of visually impaired and legally blind. These are smart glasses solutions. And in the US alone, we have over 6 million individuals who need a solution today. They want to see. They want to see their family. They want to read. We've independently tested our full system with the contact lenses and demonstrated up to 20/20 capability. And we've moved significantly through the FDA process for that combination system. Again, the big news for this year is that the standalone system offers a great deal of value. Again, there's novel elements that Innovega has developed and will take to market. And literally, we would like that product to go to market by the end of next year. And the time to market, it depends only on our ability to raise and deploy the funds we need to commercialize. We just got back from Taiwan in the last week or so. We met with contract manufacturers. We've selected a manufacturer for the standalone glasses, and we're negotiating agreements now that would accelerate manufacture, development, and then manufacture of the products for this market. So for those of you who are an accredited investor, please invest now. We'll leave this round open for a week or two. The more we can get into this round, the more quickly we can move on to some of these imperatives. And literally to join us, you just go to our website, the innovega.io. In the upper right-hand corner, you'll see a button that says Invest Now, and that will take you through the process. We have a good number of folks who've started the process of investing and still need to get certain forms completed. I urge you to do that. Okay, I'll now close this, stop sharing, and we'll see if we have any questions yet from the chat. And Michelle, if you can hear me, are you able to see whether we have any questions that have come in?
Yes, this is at the Q&A at the bottom.
Okay.
and then you can take a look at the questions there.
Okay, fair enough. Thank you. Thank you. Okay, how can I connect with your company to help my uncle in India who's legally blind and can use this innovation? I think the best avenue there is to reach me directly. I'd love to hear more about what his disease is, and we can chat about whether there's opportunity. As mentioned, the standalone glasses, we could launch product in India as well as we could launch product in the United States. So the answer to that is for you to reach me. And my email is simply steve@innovega-inc.com. So if you could send me that, that'd be perfect. Are these glasses suitable for stroke patients where they've lost vision on the left half of each eye? The answer is probably yes, because what we do is we magnify what is being looked at, what is being viewed very significantly, and we also brighten the image, and we get to play with things like contrast and even coloration. So a person who's had a stroke obviously has limited visual capability, and by what we found is by magnifying and changing the brightness and such, there's good impact. So I would, again, we're surprised. Our team, our engineering team is surprised at how effective these glasses are. And even in instances where we didn't anticipate a specific outcome for a patient, we got that outcome. We got a very positive outcome. So never say never. And again, you could reach me directly and I could dig into that a little bit more for you. And that was a question from Nicole. And the other question Nicole had is the FDA approval at risk given the impacts of DOJ? Maybe the answer is that because of our standalone glasses that do not need an FDA approval, we're managing that risk. There is a potential that the FDA timeline, the FDA process extends if DOJ has a significant impact on their resources. But it's not an issue for Innovega. We're charging ahead. The next one we have from Narek, do the glasses need to be recharged over time? Do they have a primary battery of some sort? The plan is to tether the battery, to tether the glasses, connect the glasses to a smartphone first. Ultimately, they will be standalone glasses with their own battery and their own compute and their own processing, just like a standalone cell phone, smartphone, they'll be standalone glasses. But to get to market quick, since all of us own a smartphone. Just like we tether buds down to our smartphone, we'll tether with a small cord down to a smartphone, and that will provide the battery. And so that will give the full day wearable for an individual who needs it. If you're legally blind in the morning, you're legally blind throughout the day and throughout your life. Next question. What are your most immediate funding needs and what milestones will this next round help you with? In this round that we're concluding now for accredited investors is what we call a bridge round. It's a small round. It's $1 million total. We've raised about 3/4 of it. And it just allows us to prepare for a larger round starting literally in the next couple of months. This round is for accredited investors, those who have a certain net worth. The next round will be for those who don't necessarily qualify for that, for the general public. So this round is a bridge round to enable us to open with vengeance so that we can perform well on the crowdfunding round that we're planning. We did a crowdfunding round about 3 years ago. We raised over $5 million. And that's the subsequent round that we're opening. Now, with monies coming in the next quarter or two, we will commit immediately to the contract manufacturer that we have selected, and we'll be working hand in glove with them. They're an incredibly large, impressive group, and they're convinced that this product will be absolutely successful. Are we positioning Innovega for an acquisition, or do we see a potential IPO? We're certainly positioning Innovega to get the resources it needs to be successful. And we've also had shareholders that have been with us for a good amount of time now, and we'd like them to have exit opportunities. So the answer is yes. We would be open to being acquired, and maybe it's inevitable that we'll be acquired, and that would be delightful because we'd get so much more in the way of resources and shortening time to market. As for an IPO, it's something that I and my team understand well. And if market conditions allow, we would seriously consider an IPO. Markets are choppy today. It's making everyone very nervous, but my experience in financial markets is they do turn. And when they do, they turn, very quickly. What's the target price for the standalone glasses? We haven't sorted that out yet. It appears that the competitors are charging anywhere from $4,500, $4,000 to $7,000. It's our intent to be at the low end of that and perhaps significantly lower than that. And it's not because our costs are that much lower. It's because we want to get high penetration into this market. There's probably a handful, probably several thousand individuals wearing glasses or headsets or goggles today of a market of 285 million. So there's been no penetration, no success in serving this market and giving these individuals the help they need. So if we can do that through, more aggressive pricing, we will. And the question was about partnerships and such, about, I think it's about insurance. We have explored that, and in terms of reimbursement, I think that's the proper term. And we do expect these glasses to be supported by insurers, at least certain insurers that we've had conversations with. They are very positive about getting the glasses at some level monetized to assist those that need them. What additional features does the contacts and glasses have versus wearing only glasses? It comes down to performance. The glasses themselves are about, in fact, they're about the same size, I was going to say. They're light, they're comfortable, they're cool, maybe even more so, slightly more so than the standalone because there's no lenses inside the glasses. But the level of performance, the level of magnification and such is greater. Could think of it as up to 4 times the size of the screen, 4 times the level of magnification. So those who have very severe legal impairment, just absolutely at that end of the spectrum, they could benefit from our combination, whereas they could not benefit from the standalone. I have another question. Given the assistive potential, are you collaborating with any disability advocacy groups, VA or vocational rehabilitation services? These are great questions. We're not yet. We absolutely intend to. And VA hospital, for example, there's 1 million visually impaired that are served by the VA and something like 300,000 legally blind. So we'll absolutely go to the VA and offer our magic for their membership. And of course, Lighthouse for the Blind and many other agencies and supporting groups, we will introduce ourselves and ask, how do we help? How do we participate with you to get the message out to this, again, 6 million, 7 million folks, even in the US, that we feel we could help immediately. And Sam has got another question. Which channel do you expect to generate the highest margin, revenue, medical enterprise, defense, et cetera, et cetera? I will tell you that we are shocked by the size of the vision impairment market, and we're shocked that there's been so little given to those individuals to assist them. So it's our belief that the vision impairment market, followed by other impairments, potentially, I mentioned hearing or combination hearing and sight, we think they're enormous, and of course that's exciting for us. Given it's all about impact, giving back and giving back to humanity. It's an enormous opportunity. We've done about $6 million of defense work in the past, government and defense work. So that is interesting for us. We've also been thinking through various sports applications and even spectator sports applications. So many large markets, but our mission today is to get to the vision impaired as quickly as possible. Just demonstrate that we are offering something that was never anticipated, either by the users, by the patients, or by others. And it's going to put smart glasses on the map. We'll extend the same glasses into the other applications. And I have another question, and this one is Mojo Vision. With competitors like Mojo Vision who've paused their lens development, what lessons have you learned from their challenges? And how is Innovega different? Mojo Vision decided to essentially place an entire glasses display inside a contact lens. It's extremely challenging. I mean, putting batteries and transistors and projectors inside a lens and expecting that lens to remain comfortable, disposable, expecting the FDA to have an easy time with something that's generating heat, radiation, always felt to us like an absolute non-starter. So the fundamental difference is we use a modern, soft, disposable contact lens, but rather than putting electronics or bulky components inside the lens, we have milligrams, literally, of an optical material with zero electronics and therefore fully disposable. So we are as different from Mojo Vision as you might think, as you could think, and for that reason, we progressed far more than they ever did. There's one more question coming in. What's the plan for scaling manufacturing distribution, especially if the custom lens prescriptions are required for each user? So the answer is that our glasses will not need a custom lens prescription. That will be an option. You'd be able to wear our standalone glasses with a person's own prescription. It'll be some sort of a snap-in prescription, or with their own contact lens if they have a conventional contact lens, just to improve the performance even of the standalone glasses, but they're not mandatory. So in other words, there will be generic glasses. We will personalize it in terms of magnification and brightness and contrast and et cetera, but there will not be a need for a specific prescription. If one adds a prescription as an option, they just get more powerful for the wearer. And on that basis, scaling is a lot easier. We think about scaling the glasses separately from adding the accessory of a snap-in prescription lens or a person wearing a contact lens. And a cool way to think about all this is that there's really three models all of a sudden. There is the generic glasses that can be sold literally to anyone and digitally, right, we're personalized, I suppose, by an individual with their specific disease and specific needs. And then they can add their prescription. They're going to request from us a prescription, or they can wear it with contact lenses, kind of a second level of performance, or they can use our contact lens, again, with glasses that take the performance even higher. So that, hopefully that's something you understand. I was clear for you. It looks like that's the last question. What I'd like to do is to bring, if we can do this, to bring Isaac onto the call. And again, Isaac is an advisor to us, and he is legally blind, and he was in one of he was the first video, and hopefully you were able to see enough of that if it was a little choppy. But if we can bring Isaac onto the call, that would be fantastic. So let me see if we're able to do that. Michelle, are you able to see where we could unmute Isaac's mic at all? Let me see.
As the host, you can, I believe.
Okay.
If not, Isaac, I sent you an email separately for you how to re-log in to the call.
Okay. And I see Isaac is here now. I'm hitting allow to talk. So if Isaac, if you're still on the call, if you'd like to introduce yourself, and you'll have to unmute if you're able to do that from your side. There we go. Morning, Isaac.
Good morning, everyone. How's everyone doing?
Good to hear from you.
Yes, sir. Thank you for having me on this call. I'm currently just got to a track meet. I'm not in any type of rush to get off, so you have my undivided attention. So yeah, man. Where do we start, Steve? How would you want me?
Yeah, you have actually tested both of our glasses, both the combination glasses, and then more recently coming out to test the standalone glasses. And you've also experienced others with various vision diseases and many of them legally blind. And you saw their expression on their faces, I'll say, after wearing the glasses. But if you want to offer any insights, additional insights into your experience at our clinic and what it could mean to you, that'd be fantastic.
Absolutely. So just to give everyone that's on the call a little reference to my vision impairment, I was born with juvenile retinoschisis. I was diagnosed at the age of 2. From there, I was left with 20% of my vision. So the way that I see isn't just through my eyes, it's through all my senses, right? And I had to adapt through life that way. I've tried every visual impairment tool that you can imagine, from CCTVs to the rhombus to magnifying glass, binoculars, everything. And I must say that the technology that we are creating with Innovega right now is truly revolutionary. I just recall times of being a child and being in school and not being able to read the chalkboard or not being able to learn like every other kid. It was difficult for me because I had to learn a whole totally different way from everyone else. And when I put on these glasses, the technology that Innovega is coming out with, it gave me the thought that, man, the little kid Isaac, you know what I'm saying, that struggled reading from distances, from the chalkboard, from the overhead, can now see that now, and now could not only just see that, could be included in learning just like every other kid without having the stigma that comes with having a disability as being a child, right? As a child, like, everyone wanted to use my tools to see what that was and what this was, you know, and it was quite overbearing, right? So Innovega is giving people like myself an opportunity to feel that normalcy, whatever that may mean, right? But also making disabilities look really cool, you know, instead of being a spectacle, it's like the glasses are allowing us to fit in, you know. And I know from all the other videos that you guys watch, the main thing is just having that human connection. And the first part of having human connection is through the eyes. It's the way that you see. The first thing that you see is you're connected to. So with us being visually impaired and having these glasses, it just heightens that opportunity to build a much more human connection. For me, I want to have that connection with my daughter. I want to be able to see my daughter and see her smile, right? Same with Megan, another parent with a visual impairment. You know, her biggest thing is, I just want to see my son smile, and I want to be able to smile back at my son and let my son know that mommy loves him, you know, through nonverbal communication, right? So when we think about these glasses, it's not just glasses. It's something that's literally changing the lives of people that saw the world in one way, but now can see the world in multiple different ways, see the world more clearly now, through the lens of Innovega. And I know our tagline is bringing the future into focus. We're literally doing that. Everybody on this call and everybody around the world that is going to be supporting Innovega is literally bringing that future into focus, giving people an opportunity to experience life in a whole new way. I mean, one of my passions outside of sports has been my gateway to freedom. But like you all know, sports has an expiration date. I can't run and jump for the rest of my life, right? So I'm going to have to find something else to help me just go through life, right? Another profession. And one of my passions is writing and being in television. Um, I know I spoke to Steve and the crew, and I told him, like, I love karaoke. I love to, you know, get on stage and just embody the song. But the one thing that I can't do is see the karaoke screen. So just imagine, like, I have these glasses on. I can read a teleprompter. I can do karaoke. I can read a speech. You know, I do commencement speeches, and it's difficult for me to just memorize everything. I do a great job. Don't get me wrong. I do my thing. But just imagine me being able to do a commencement speech flawlessly with the capability of being able to see my actual speech, right? And see which part of the speech is going to hit the hardest, right? So like these glasses, man, um, they're a blessing, you know, being able to work with Innovega in this capacity, and not only for myself, but all the other individuals with visual impairments. And as you guys see, like, you have a wide range of people from young to old, you know, and they get even younger. I work with so many organizations within the disability community, and I just see kids with visual impairments, hearing impairments, all types of disabilities. And this specific community has been lacking the resources and the support it needs to allow their people to strive and thrive, right? And so Innovega is bringing that to the forefront, and I'm just super excited to be involved because, like, we're literally giving people a new chance to live a productive and confident life. So my experience with the glasses, I wore both of the prototypes, the contact lens and the Zebra. The eye optic, let me be specific on which product I use. The eye optic and the Zebra, both of them groundbreaking. I prefer the Zebra because I'm more active, and I feel like the Zebra will be more of beneficial for me because of how active I am. I'm always walking around and doing things. Not saying that the eye optic wouldn't allow you to do the same thing, but I've never wore contact lenses until the eye optic. So that is just, scary to me, to be quite honest, right? Just having something on your little eyeball is scary. So me, I gravitate towards the Zebra, but like I said, both of the products are phenomenal, and they work tremendously well. So that is that's the great thing about it all. So
Isaac,
that,
thanks so much. Yeah,
yes,
you
sir.
said some wonderful things there. It's almost a movement, the way you're describing it. It's a passion that we all have. Innovega was started to solve a problem that was unsolvable. Like, how do you get, IMAX quality performance and functionality in a normal pair of glasses? It's not possible. Laws of physics say it's not possible. That gets a lot of engineers in a room and gets them excited. So we were an absolute hard science, deep tech company until we recognized the impact we could have on this community that you're describing so well. Now, all of a sudden, we're all about humanity, all about giving back. If we can take best of breed technology and apply it anywhere, who gets it first? Is it the gamer, or is it the warehouse worker, or is it these patients? So I think you said it well. Can I share what your prescription is, Isaac?
Absolutely.
Okay. So Isaac, we measured his prescription. It was 2,430. So what that means, not 20/20, not a little worse at 20/40, but 2,430. So his eyesight is 22 times worse than a person with normal vision or correctable normal vision, which means that if he went to the optometrist, he wouldn't be 10 feet away from the chart, reading down the chart. He would be 10 feet divided by 12. He'd be 5 inches away. So we're taking Isaac, who has to be 5 inches away from that chart to read it as we read it, not 10 feet, and that allowing him instead to be 10 feet away. So when he talks about his young daughter, he doesn't have to be 6 inches away to see every freckle and eyelash. He can be 10 feet away. That's where everything changes. He can now be connected at normal distances, just normal experiences. So it's remarkable. And we've had folks who are even worse, 4 times worse than Isaac from standpoint of his vision, and have been able to correct them and offer them value. So it's an amazing opportunity. We're humbled at Innovega to be going down this path, and all we need now is to accelerate it. I'll say again, the only thing that stops us getting these standalone glasses, and our code name is Zebra. So you all know it now. Isaac has shared that internally. We like to give things names. So we have eye optic, which is the optic on the eye, the contact lens, and then separately we have this Zebra. And so only thing that stops us getting Zebra to market next year is how fast we raise the money we need to do so. And we've got a small round now for accredited investors. We got to close it up in the next week or two, and then we will be opening another round for the absolute public over the next couple of months. So that's where we stand. And boy, you've given me a lot of your time. Thank you so much. I see you're still all on board here, hanging in there with us. If you want further information, please reach out to me. You've got my email address there, steve@innovega-inc.com. And unless there's other questions, we'll bring this session to a close. Hopefully it was valuable for you. Thank you so much.